On behalf of the National Eczema Association, I'd like to welcome you all to our presentation, From Waiting Room to Results, Making Your Eczema Visits Count. I'm your host, Nora Egenbrot. Today's webinar is made possible in part by an educational grant from Sanofi Regeneron. Our presenter today is Dr. Jeff Yu. Dr. Yu is a board-certified dermatologist and fellowship-trained pediatric dermatologist at Mass General in Boston, Massachusetts. He specializes in allergic contact dermatitis and occupational dermatitis in adults and children. And with that, I am pleased to introduce our presenter, Dr. Yu. I'll hand it over to you, Dr. Yu.
Great. Thank you so much, Nora, and welcome everybody. I'm really happy to have this opportunity to discuss with you guys something that you probably don't hear a lot about when it comes to presentations or speaking with your friends or social media or speaking with other doctors. But I do think this is one of those really important topics when it comes to managing your eczema and finding out more information, and that is, how do you really make the most of these eczema visits? I run a specialized eczema clinic at Mass General Hospital over the last several years, and I've had the pleasure of seeing a lot of kids, adults with eczema, as well as their caregivers, and have interacted with many people from not just the Boston area, but really all over the country who have come to see me. So just some background information that you guys probably already know. Eczema affects about 10 to 20% of children, about 10% of adults, so it's exceedingly common in the general population. But there's really not enough doctors anywhere to see you in a timely fashion. Not only are there not enough dermatologists, there are certainly not enough primary care doctors, pediatricians, or what have you that you are trying to see. In the United States, at least, there's only about 3.8 dermatologists per 100,000 people in a community. So you can imagine that those numbers are pretty inadequate in terms of serving everybody that is out there that probably needs some sort of dermatologic help, whether it's eczema or looking at mold or whatever it may be. And then the pediatric dermatology density is even lower at less than half of a pediatric dermatologist per 100,000 children. And there are some parts of the country or some states in the country that really have no pediatric dermatology um, providers at all. This is just a map that kind of shows you different parts of the country and where the different providers are. You can see down here on the right-hand side that areas outlined in red have greater than 10 dermatologists per 100,000 people, but areas that are either white or gray, which is probably most of the middle of the country actually, have have about 0 to 1 dermatologist per 100,000 people. So you can see that much of the country is largely unserved unless you are living in one of these major metropolitan areas, places like San Francisco, Los Angeles, Boston, New York, Washington, D.C., Miami, Florida, places like that, where you probably have a really high number of dermatologists. But if you're really not living in one of those areas, you're going to have a hard time finding a dermatologist, meaning that if you are able to get a dermatology visit, my guess is they're probably not very frequent and they probably don't last very long. So here we are now talking about, once you do get a dermatology appointment, what are you really gearing up for, and what is the best way to prepare yourself for so you make the most of it? And that's really the key here. So number one is, you have to know who you are seeing. So not all providers are the same. Because of the lack of dermatologists in the United States, there have been a lot of um, kind of affiliated providers that have kind of popped up to serve this need, which I think many of them do a fantastic job. But these are really your physician assistants and nurse practitioners that have kind of opened up practices and work alongside dermatologists that fill this critical need for providers who have some expertise in skin to see you. Now, they're not all trained the same, right? Everybody has a different background in terms of training. So if you're really looking for that top expertise when it comes to atopic dermatitis, so if you have really difficult to manage disease, you're probably best off seeing a physician, especially a dermatologist. Now, can are dermatologists the only people that can see somebody with eczema? No, you can certainly see allergists, which I think a lot of patients do turn to when it comes to managing their atopic dermatitis, oftentimes because they probably also have another comorbid disease, things such as food allergies, asthma, things like that, where the allergists do a fantastic job managing, certainly better than dermatologists do, and or your primary care doctor, whether that is your family medicine provider, your internal medicine provider, or your pediatrician. Everybody in this group can certainly see patients who have eczema. Then there are some non-physicians or non-medical practitioners, and then you're kind of going into the naturopaths, the holistic practitioners, the wellness coaches, functional medicine. A lot of these providers do not really dispense Western medicine and or largely evidence-based medicine health. Now, a lot of them do great work in terms of acupuncture, traditional Chinese medicine. I think they certainly have some evidence showing that they can help with eczema, but these are not the people you are going to see when you are hoping to get, say, a bacterial infection treated, when you are hoping to go on one of these newer systemic medications for eczema and things like that. And they're probably going to be able to provide very limited information when it comes to some of these novel treatments. And then finally, probably I think the folks that might have the least amount of credible medical information are these skinfluencers that you see popping up on TikTok, on social media, for example, where you can probably get some information, but be careful because not all of that information is vetted and not all of that information is accurate and backed by evidence. Now, if you are fortunate enough to live in one of these cities, for example, there are several of these programs called atopic dermatitis clinics. You can see that I run one at Mass General here on the top left. Dr. Peter Leo, who is certainly not a stranger to any of us, runs a great eczema center in Chicago. Dr. Larry Eichenfeld, for example, does a great multidisciplinary atopic dermatitis program where he is working with allergists and dietitians and other providers as well, who was really able to offer that comprehensive treatment for atopic dermatitis. And I think if you are fortunate enough to be living in one of these cities where this is a resource to you, I certainly would encourage you to seek this out because you are probably going to find really the most up to date, as well as folks who probably see a lot of these patients and therefore have the most expertise when it comes to treating your eczema. Just to kind of put in a plug for dermatologists in general, the American Academy of Dermatology kind of put this out just to make people aware of the number of years that dermatologists really spend focusing on the skin when it comes to skin health. And certainly, I think if you do have a skin related question, seeing a dermatologist perhaps is going to be your best bet when it comes to eczema. Is this not eczema? Is there something causing my eczema to flare? These are all great questions that you can ask your dermatologist. So just to kind of get into your dermatology appointment a little bit, most of these visits are about 10 to 15 minutes in length. Now, this is not because dermatologists don't really want to spend time with you. As you can imagine, with the number of dermatologists out there, a number of patients seeking appointments, most of my patients, for example, are waiting about 6 months before they are able to get in. And these are even for follow-up visits, meaning patients that have been seen in our clinic that want to make a follow-up. The soonest appointment might be anywhere between 3 to 6 months. So you can imagine that there is a crushing load of people who are hoping to get in. So most of these visits end up not being very long. So what I'm trying to get at there is that do not be late, because if you're about 10 minutes late into a 15-minute appointment, either you're not going to be seen, or you're going to have a very short appointment, or your dermatologist, when they see you, are probably trying to rush through that appointment. So you are not going to get all of your questions answered, and certainly not going to get as much attention as you probably deserve. So I would encourage you to definitely not be late and plan ahead. The next part is to be prepared for these visits, because a lot of times in our fragmented healthcare system in the United States, if you've been seen at medical center X and now you're coming to see me at medical center Y, don't assume that medical center X sent me all of your records, because even though their office staff might say, oh, yeah, we fax it over, there's a good chance I never got those records, because honestly, who has a fax machine nowadays, right? So really, you should, if you can, get a copy of those records and bring it with you, because that is probably the best way to make sure that the doctor that you are seeing that day is able to get those records from you. Now, don't expect him or her to look at that right then and there, because again, during your visit, it's probably more important to address the questions that you have and really kind of figure out this history a little bit later on, maybe after the visit or on another day. But he or she will certainly look at it. It just might not be right then and there. And sometimes patients are able to provide a really quick summary, and I think that is always the most helpful. And I'm going to get to kind of what goes into that quick summary here. So important things to include, right? And questions I ask all of my patients here is number one, when did your eczema start? Because I think it's important to know whether it started when you were a kid or did it just suddenly start last week, the month before, the year before, because then we might be probing into something as to what happened, what changed, could there have been a trigger for your eczema? Another really important question, I think, is where is it? If you just tell me it's on your eyelids, it's a little bit different than if you told me that it was all over your body, because then I'm kind of focused on something that may be a little bit different. It's important to know what are some of the worst areas, because perhaps I would treat it a little bit differently. For example, your hand eczema versus your eyelid eczema, I'm going to be giving you two very different prescriptions to treat those locations. It's really important to know what have you tried, because I don't want to recreate the wheel here. I don't want to give you something that you've already failed in the past, because that's really not going to help you. You're going to be frustrated. We're going to be frustrated. I think it's really helpful to know if you can say, I have tried X cream, Y ointment, Z injection, and none of these things have been really helpful. And either you failed them because they didn't work, or perhaps you couldn't tolerate them because of side effects. All those things I think are really important for your doctor to know. And then finally, do you notice any triggers? If you say, every time I go and play basketball, every time I go to the gym, every time I go swim in a pool, my eczema flares, I think that's going to lead to a very different conversation than you telling me that your eczema flares all the time, your eczema flares with stress, your eczema flares in the winter, because then we might consider different types of testing, such as prick or patch testing, that can maybe elicit whether or not there is an allergy that is truly triggering your atopic dermatitis here. This might seem like a silly topic, but I do think it's pretty important, is how do you dress for your appointment? I think anybody that sees you in the clinic should be doing a skin exam, because sometimes there might be clues on your skin that might say something along the lines of, well, is this eczema in the first place? Could this be another skin condition that looks a lot like eczema, but perhaps it's not eczema? Sometimes things like fungal infections, psoriasis, all that kind of stuff can mimic eczema. And I think any dermatologist that has really done a good job should be taking a look at your skin, meaning they should be able to see your skin. Now, do not, completely unnecessary to take off underclothing. I think all your underclothing should remain on. What's most important is that I can get a good survey of your skin, your back, your belly, your arms, your legs, places like that. I think loose fitting clothing, easy to change in and out of clothing is really appropriate. Really tight fit clothing, many layers, difficult to button things, probably a little bit less appropriate for that visit. And then, this is something that patients always say. They're like, "Oh, I didn't get a pedicure today. Excuse my nails." I don't care at all. Trust me, we have seen much worse. All right. It does not matter if you are clean. It does not matter if your hair is cut. Come as you are, and we will take a look at your skin. All right, now how do we talk to our doctors about our eczema? I think it's really important when you show up there to kind of prioritize the conversation, because I want to know, what are your main concerns today, right? If you tell me I've had eczema for the last 10 years, it's overall very well managed, then I'm going to be like, well, what brings you in here today? Because what are you here to talk about? Because if you say, well, I just want to refill of my topical medication, well, that's a very easy visit. But if you say, I feel like my eczema is flaring much more today, I want to consider maybe going on another medication, I'm having side effects with this medication, I want to do something different, that really kind of um, that targets your conversation in a slightly different direction and really is able to let me address what you are there to talk about, instead of me dancing around for 10 minutes and then finally realizing, well, that is actually your question and I really didn't hit the nail on the head here. I want you to make sure that you are getting your questions addressed first. And then if you have other issues that may be not related to your eczema, or maybe that are, not as important that day, they can certainly be discussed a little bit later, or sometimes even with a phone call after the visit. I think it's really important to discuss your goals, because what are you trying to get out of this appointment today? How much does your eczema bother you? I can see people who have pretty terrible eczema and they say, nah, it doesn't really bother me that much and I'm okay with moisturizing. And I see people who have much less eczema, but maybe on more bothersome areas of their body, like their eyelids, and they say, I really want to, nip this in the bud and hit it as hard as I can. That will make me get either more aggressive or less aggressive with your treatment. Again, we kind of talked about goals to make sure that you kind of put that front and center with with your visit. Kind of don't dance around it, but just say, "This is what I'm here for today. This is what I want to talk about. Let's discuss these things." And then I think that really helps us gear that conversation towards you, which is by far the most important part of that visit. Do you want to discuss treatment? Do you want to discuss management? Do you want to discuss more testing? Really important to let us know. Um, Sometimes we have other people in that room too. Oftentimes, people will come with their spouse. Oftentimes, parents will come with their kids. Oftentimes, there'll be a caretaker, a grandmother, or somebody else in the room. And sometimes the conversation becomes less productive when they are contradicting one another. So, if the mom says one thing, the dad says another, and then it's really hard to get a clear story on exactly what is going on. So, I would say make sure that you are kind of on the same page when it comes to how the eczema or how your child is doing. It's really not helpful to speak over one another because then it really, again, mixes up the message, and then your dermatologist is really not able to get a very clear history. But one thing that it is okay to do is that make sure that it is okay to cry and it's okay to be emotional because eczema is tough, right? It's a tough disease. And I have many patients kind of cry in the room, either because they're happy that they're finally getting better or they are crying because their eczema is flaring and is getting in the way of their personal or professional lives. And I think that part is completely okay. And no one will ever fault you for that. But I would make sure that when you are transmitting a story or when you are trying to get a history out, making sure that it is consistent and clear can be really helpful. Sometimes there are apps out there that are also able to kind of tell the story. So if you're having a hard time saying, well, it flared yesterday, but it didn't flare the day before, and it flared the day before that, and sometimes that gets a little bit jumbled and difficult. So Nia has come out with this wonderful app called Eczema Wise. And what that does is that it's an app that you can download on your phone, and you can kind of use that to track your eczema, meaning you can kind of input data and say, well, today was a really great day. These are the areas that were itchy. This is what I used on my skin. And then you're able to give that to your doctor and they're able to take a look at it. And then they're able to say, based on this, it seems like your eczema is doing better with this prescription because you are saying you're itching less, you have more good days than bad days, or your eczema definitely seems to be flaring when you're having a lot more bad days than you are having good days. And I think this is really able to help track your disease and really kind of show that to your doctor. Think about this as one of those things like your blood pressure diary, right? Sometimes your doctor will tell you to keep track of your blood pressure, write all of it down so he or she can take a look and see how your blood pressure control is going, something like that. And this is really one way of tracking your eczema using an app. There may be other apps out there, and I think if you found one that works for you, great. But this is the one that I have seen patients really enjoy using. Photos. I probably have 90% of my patients bring photos. And usually what I hear is, my skin is great today, of course, because I am coming in to see you. So sometimes we do not get the best representation of what your skin is doing during that day or on that visit. So I would absolutely encourage you to take photos. We know that eczema is not a static disease. We know that eczema flares and gets better and flares and gets better. And I want to know, how bad does your eczema get? Because what I see in front of me today might not be how bad your eczema is. So I don't want to underestimate how bad your disease is. So I think taking photos is really good. And this is an example of a really good photo, right? Clear background, focused, not blurry, and I can get a pretty good representation of your eczema on the back of your hand. Compared to this is not a great photo. Blurry background, blurry foreground. I don't really know what I'm looking at. Can I appreciate that there are kind of red bumps throughout? I could, but I can't really tell you that I'm looking at eczema. I can't really tell you how bad the eczema is. I can't really tell you if these are blisters because maybe I'm worried about things like shingles. I can't tell you what I'm really looking at. So this is an example of a photo that will probably be much less helpful when it comes to me trying to understand what your eczema flares look like. Now, I think it's great if you want to share photos, but I want to make sure that when you come in, make sure all your photos are organized. Some patients do a great job creating a folder on their phone and putting all of their photos in there. So the second they get in, they show me these photos and I'm able to scroll through it myself. Sometimes people don't do as good of a job and they say, "Oh, I have a photo in here somewhere." As you're going through hundreds of vacation photos to find the photo of your eczema, remember, this is time, right? Like time is kind of going by and we're not really moving that conversation forward and we're not really able to talk about your eczema. Instead, you're kind of, stressing out a little bit trying to find those photos of you that you took maybe 3 months ago, 100 or 200 photos in the past, and you might have missed it. So I think organizing it and making sure that you have a folder so you're quickly ready to show that can be really helpful to make sure that we kind of target that conversation and get to the meat of the visit there. All right. Support system is super important. Nobody should be going through terrible eczema by themselves. You want people to talk to, you want friends to talk to, you want peers, you want parents, grandparents, whatnot, to all be involved here. And when you have a kid, ideally, parents being involved is definitely good because they know what they're using on the child. So I always encourage people to involve others in the conversation when it comes to these visits. You want to bring somebody with you? Great, bring somebody with you. Want to bring both parents? Bring both parents. You want me to call somebody on the phone while we're in the visit? I'd be more than happy to do that because I think the more information that people can provide me, the better I am able to understand exactly what it is that you are going through. Now, one thing that I do not think works very well is we get through this entire visit and we get to the end, and then someone says, "Oh, do you mind calling my wife so you can tell her this entire story?" That doesn't really go over very well because I'm sure, that person has other questions they want to answer. Maybe there was something that was lost in translation. Maybe we have to redo the entire visit over again. And again, there's probably not enough time to do that. So if there is somebody you want to get on the phone, do it at the beginning of the visit. So that way the conversation is done in tandem, not in series one after the other, where you kind of have to redo the entire thing. All right. And so a lot of times, I will have, dads kind of bring in the kid, and then I will ask, "So what kind of moisturizer do you use?" And he goes, "I don't know. Mom does it." Or, "What kind of medication do you put on?" "I don't know. Mom does it." Now, I'm definitely stereotyping here, and I certainly see this more with dads than I see with moms. And usually moms are very much on top of it. And I've definitely seen the reverse happen here as well. But this is one of those situations where it'd be really helpful to get mom on the phone, for example, so I'm not just writing down, "Dad doesn't know what we put on there," or "We have no idea what kind of moisturizer we're using." It's really helpful to know whether or not you're moisturizing at all, what kind of medications you're using. And I think having, again, more information and more support people is always going to be more helpful than maybe not having that information in the first place. So these are situations where I will encourage you, FaceTime the other person, call the other person, whether it's dad, whether it's mom, whether it's grandma, whether it's the nanny, whatever it may be. I think more information is always better than less. Do not be shy about asking for this. I think it's better to get more information than it is to get less. What about specialist referrals? Because sometimes perhaps you need other people to help manage your eczema at the same time. So if you are currently seeing your pediatrician, your primary care doctor, or even your allergist, I think it's really important to think about, well, when should you really start to see a dermatologist during this visit? If you are not seeing one already, perhaps you can ask him or her for a referral, and I think that is completely appropriate. Do you think there is something else that may be triggering your eczema? Because perhaps then seeing a dermatologist would be appropriate, or maybe an allergist for prick testing if you're wondering about environmental or food allergies. If you are getting sad or if you feel like you have a lot of anxiety because of your eczema, perhaps seeing a psychiatrist or a behavioral health specialist would also be really appropriate. And then finally, if you have things like I'm having, asthma, I'm having trouble breathing, swallowing, things like that, then you might have to see other physicians. And I think it's really important to ask for that because I may not know that you are having trouble breathing. I may not know that you are having anxiety. I may not know that you're having sinus issues. And if you're not telling me these things, I may not be able to refer you to the appropriate people. So please bring these up because we all know eczema is not just a skin limited disease. It certainly has psychiatric overtones. You can certainly have other medical comorbidities with it. Dermatologists are really just not the appropriate people to really be looking at those things. But I think if you say something, we are able to refer you to the right people. Now, what about treatment options? So I think a lot of people come to clinic because you want to know what is the best way to help manage my eczema. So the good news is today we have so many treatments under our belt that we are able to use that we were never able to use in the past. 20, 30 years ago, we were really limited to a number of topical medications, mostly topical steroids, and some really old immunosuppressive medications that do a poor job managing our eczema and have a host of side effects. Starting about less than 10 years ago, we started having all these great biologics and JAK inhibitors out there that we now use very frequently for people who have very severe eczema, and we use it very successfully. Now, these guidelines were published by the American Academy of Dermatology back in, I believe, 2024. And you can see that two of these biologics that are now available, lebrikizumab and nemolizumab, were not even on here because that is how rapidly the landscape of treatment is shifting. Just in about a year or two, we ended up with two new biologics that we are now using. And I'll bet you in the next year or two, we are going to have one or two more biologics that are going to be available for the treatment of eczema. So I do think that there is a lot that is changing. And I think if you see a provider that may not really be up to date on this, he or she might be missing out on some of these newer, better, safer, and more effective treatments for your eczema. So therefore, I think it's really important to see somebody that perhaps treats a lot of eczema or do a really good job taking care of patients with eczema. So you don't have to make a treatment decision today. You don't have to walk out of the office knowing exactly what it is that you are going to use for your eczema. You can go home and think about it. And I would encourage you to do that because my job is not to tell you what you should go on. My job is to present you with the options and you make the decision of what is best for you. So your decision points could include things like, do you want to go on a topical medication or a systemic medication? Do you want to go on a pill or do you want to take a shot, such as in a biologic? Do you want something that works really quickly or do you want something that maybe works a little bit slower, but you can use it for the next 2, 3, 4 years without worrying about some potential side effects? And then, very importantly, is cost. How much is it going to cost me to go on this medication? Is my insurance going to cover this? And I think this ends up being a bigger issue for people who are maybe on Medicare, for example. Many patients come in to me though with the treatment in mind. They might say something like, "Oh, my cousin has terrible eczema and he or she is on this treatment and I want to be on this too." Then, if that is appropriate and all things being equal, I would absolutely be happy to give you that treatment just so you can try it and see if it also works for you. And that could save people a lot of time in terms of figuring out which treatment that you would want to go on. So don't let your dermatologist or any provider kind of corner you into saying you need to be on this medication. I think he or she should really provide you with the available information. And then that way you can kind of make that best decision that works for you, that works for your family, that works for your child, and that works for your lifestyle. So questions to ask when it comes to treatment. So for example, if I say, well, I think you should go on treatment X, I think the questions you should ask are, how quickly does it work? Because some of these medications have data that shows that even after 2 days, the itch improves a lot. Some have data that shows after 2 weeks, your quality starts to improve. For example, how well does it work? Right? One of the really important indicators is, well, how much better does this make my eczema? And there's a lot of data that says, well, this medication can, for example, 50 or 60% of the people get 75% or better. But this other medication, 80% of the people get 75% or better. Which one would you pick? Well, if everything else was equal, you probably pick the one that works better. But what if I told you the one that works better might have more side effects, might work slower? These are all things that you have to think about. How often do I have to take a medication? Some are things you take every day. Some are things that you inject every 2 weeks. Some are things that you inject every month. How often do you have to take it? I think that's important depending on your lifestyle. Will insurance cover it? Because not all insurances cover all medication. And then definitely ask about side effects. No medication has no side effects. All medications have some side effects, but some may be less acceptable to you than others. For example, acne. For example, if you have a history of heart disease and this medication could potentially increase cardiac risk, is that something that you are willing to worry about? If there's a strong family history of blood clots and this medication might make you have more blood clots, is that something that you are willing to tolerate? These are really important questions that you want to ask at your visit. And Alternative and complementary treatments, I think, are fantastic when they work, and I think they play a really important role in managing patients who have eczema. That being said, they are not mainstream, and most doctors that you see may not be very familiar with these. If this is the path that you want to go down, I would really encourage you to find a doctor who is more of an expert in these areas, and you can probably find this person or these people that you want to see either in your community or somewhere online. Some of the reason why these treatments are not mainstream isn't because they don't work. I think the reason is because we don't know much about it. We certainly don't learn about these things really in medical school or during residency training. And I think a lot of these things have limited evidence because, for example, some of these treatments that we are prescribing now for eczema, they have gone through phase one, phase two, phase three studies that have had thousands or hundreds or thousands of patients in them. And we've shown that it works better than placebo. These are your traditional placebo controlled randomized trials. A lot of the alternative and complementary treatments don't have that type of evidence backing it up. They might have a small study that said five people went on acupuncture, five people got, fake acupuncture, and those five people that got real acupuncture got better. So that's the kind of evidence that backs up some of these alternative treatments. It's really hard to make a summary judgment on just five patients alone versus something that has had hundreds or thousands of patients. It's much easier to say, oh, it's very clear that this treatment works compared to those people that never got this treatment. And then there are some fads out there that I wouldn't even really label as alternative and complementary treatments. And they're really more fads that I hear about. Some of my patients will come in and say, oh, I went on the carnivore diet. And I'm like, well, what's the carnivore diet? And it's where you eat absolutely nothing but meat. Now, other than the fact that that's probably not going to make your eczema better, that is also really bad for you, right? When you're thinking about your cholesterol, when you're thinking about your gut health, when you're really thinking about all of those things, that probably is not a very good diet. But at some point, there was some popularity to this. There's also a movement of anti-moisturizing where people say, well, the more moisturizer you put on, the less your skin is able to produce its own moisturizer, and therefore you are more likely to have eczema the more you moisturize, which we know as a scientific community that that is not true. We know that moisturizing is actually very beneficial for people who have eczema. And if you were to not moisturize, your skin is going to be much worse off than if you were to moisturize in the first place. So some of these things I think are fads and not true treatments. And then some of these things are alternative and complementary treatments like acupuncture. I think, Eastern medicine, I think those are great. And I think those, if that is something you're interested in pursuing, I would certainly do your research and see somebody who was very knowledgeable in that. If you came to me with that, I would probably turn you to somebody who was much more knowledgeable than I am because I'm not really able to speak expertly on those topics. And I don't want to lead you down the wrong path. So you've kind of come to the end of your visit, and you and your dermatologist have kind of figured out, well, this is the state of my eczema. These are the worst areas. This is what I'm interested in discussing, and this is what I want to be treated with. But sometimes he or she might say, well, use this cream twice a day here, but use it only once a day here, use this cream there, use this lotion there. And all these words and all this kind of instructions really can get very confusing. So I hate letting my patients walk out not really having a written down plan of what you are supposed to do. So I always offer printed off instructions, and I always write down for your scalp, this is what you should do. For your face, this is what you do. For your body, this is what you do. And that way, if you get confused, and I think I even confuse myself when I kind of go through all of this, I think having something written down to refer to, putting it on your fridge, putting it on a bulletin board, taking a picture of it on your phone so you can refer to it, all of that can be really helpful. Some places will even offer these things called eczema action plans where it goes through and it says on a daily on a regular day what you should do, when things are bad what you should do, when things are really bad what you should do, and I think that can also be really, really helpful. Make sure your prescriptions are sent. I can't tell you the number of times that if I am not sending the prescription there, I probably will either delay or forget to send it because I've probably seen 20 patients after you by the time I come back to my computer and say, well, what did I want to prescribe for John Smith here? And I think sometimes getting it prescribed while you are there in the room can be really helpful. Not only is it helpful to get your prescription as quickly as possible, but it's also important to know if we're sending it to the right pharmacy. most of the prescriptions are now done electronically, so none of them are really done by paper anymore. So if I'm sending it to a pharmacy in New York, but you actually live in, say, Connecticut, well, I'm not sending it to the right pharmacy, and you're not really going to get your medication. So I think it's really helpful for you to confirm what pharmacy it is that you are going to pick up the medication from and to really get that sent at that visit. A lot of these newer treatments out there now have these things called copay savings cards. What that means is that even though your insurance might cover a medication, your copay might still be $200. That's not the price of the medication. The medication really costs about $2,000, but your insurance is charging you a copay of $200. By getting one of these copay cards, it can really reduce that copay down to 30 bucks, 20 bucks, or zero, for example. And I think having one of these copay cards can be really helpful. Your dermatologist doesn't have to give you one of these. You can really just Google it. And I think most prescription medications for eczema will have one of these copay savings card available. And then make sure you know when you're going to see your doctor again, because I think it's really important to say, well, my eczema is doing great. I've been on this medication for 3 years now, and I'm only here for a refill. Well, you probably don't need to see me in 3 months. I think if things are going well, I can probably just see you in a year or 2 years when I need to refill your medication. But if you're kind of in a bad place and you're really flaring and you really need a short follow up, sometimes seeing patients back in 4 weeks or 6 weeks can be really helpful because one, I can make sure that you're doing better with this treatment. And then number two, I can kind of figure out what a long-term treatment plan for you can be. But if your eczema is otherwise doing well, but we're not really stable yet, oftentimes the most frequent interval is somewhere around 3 months, maybe even 6 months, depending on how your eczema is doing. And then after the visit, now, if you go home and your eczema is doing great, but then 2 weeks down the line, your eczema suddenly flares up, you are having pain, you have a fever, you have, whatever it may be, figure out how to contact that clinic because maybe it is through a patient portal where you can send your doctor a message. Maybe you have to call the nurse and really get through that way. Maybe there is an on-call person at night. Figure these things out because it can be really helpful for when you are in a bad place. Now, if your dermatologist is not available and you feel like you are having some sort of a very severe eczema flare up where you can't sleep, you're oozing everywhere, you might have an infection, then that is a really good reason to maybe go to the emergency room. Or the local urgent care so you can get somebody to lay eyes on you to make sure that there isn't something else going on. As you all might know, 80% of people with eczema carry staph bacteria on their skin, and very often people who have poorly controlled eczema get staph infection that needs to be treated with an oral antibiotic. You might not be able to get in on the weekends, or maybe your dermatologist can't see you for another 2 weeks, and you probably need something sooner than that. I think seeing urgent care, if you think it's a less severe issue and going to the emergency room, maybe if it's a more severe issue, I think those are really good resources to kind of keep in the back of your head and really know about just to kind of make sure that you are still getting the follow up that you need. So, just as a summary here, medical dermatologists are probably your best bet when it comes to getting comprehensive eczema care. I think if you are able to access some sort of an eczema specialty center, I think you're probably going to get the most up to date and, in my opinion, with a little bit of bias, the best eczema care that that you can get for you and your family. I think making sure that you adequately prepare for these appointments is really important. Making sure that your photos are organized, knowing what your top questions are, trying to really have a goal to that visit that you want to talk about can also streamline this entire process. Making sure that you have all the information that you need. And if you don't, call that person, have them on the phone, FaceTime, or bring them with you to that visit can also be really helpful. You might not get all of your questions answered that time, but I think it's important to prioritize the top three and make sure that you're getting the most important questions answered. And perhaps if the rest are less pressing, you can save that for next time. And then at the end of the day, not all doctors are the same because all doctors are still people, right? And we all have personalities that might not suit your personality, or our office might not be the most fitting for you, or our interactions might not be what you are hoping to have out from a doctor. And I think that's okay. I think everyone's personality is different. And I think and since eczema is a chronic disease, you should have a doctor that you are happy to go see, that you're comfortable seeing. And I think if you see somebody and you're not comfortable with them, I think finding another doctor or another dermatologist is completely in your right. And nobody will be offended if you choose not to go back to that person because you're not really doing it for them. You are doing it for you. And I think you really need to be the focus of that visit and that relationship that you have with your physician. Thank you all very much. These are the kind of the tidbits that I have to share when it comes to going to a doctor for your eczema visit, and I am happy to answer any questions.
Wonderful. Thank you so much, Dr. Yu. I think that was a really comprehensive overview. I know that, patients, caregivers that we work with often have a lot of apprehension, if they wait a long time for these visits, really wanting to make sure that they make the most of those 10 to 15 minutes. So I think this was really great. Love the shout out to Eczema Wise too. I think that, that's kind of our effort to help kind of give tools for your toolbox as an eczema patient or caregiver, make sure that it's easy for you. You don't just have to rely on that folder of photos, even though I know I have one of those in my phone too. Um, Highly recommend having that folder for ease of use. But yeah, really great and practical tips to use. And I know we had a few questions come in now, so I think we have a little bit of time. I'll just run through some of these now as well. And if anyone has further questions, we still have a couple minutes here, so feel free to put those in the chat. So the first question we got is, if faxes are unreliable, is there a better way to ensure that my medical records get to my healthcare provider in advance of the appointment?
So one thing you can do is call the office, right? Call the office before your appointment. So if you say, I reached out to my other provider 2 weeks ago and they said they were going to send it that day, maybe call a few days before your next appointment with your new doctor and to ask the office and say, hey, I faxed these records over. Can you confirm that he or she has received them? I think that's probably the only way that you can really do that because you're not going to have access to that person's email. You're not really going to have access to the chart. You're not really going to have access to those things. So I think calling is probably the best way to do it.
The next question we had is, I know you mentioned sort of this standard timing of a 10 to 15-minute appointment. Is there a way to get a longer appointment than the standard 10 to 15-minute slot? On a related note, do you think that the standard 15-minute appointments are too short, or is that generally a sufficient amount of time for you as the provider?
I think it really depends on who you are. If it were up to me, none of my appointments would be 15 minutes because I do think that is too short, especially for an eczema visit. Unfortunately, in today's world, most of us, meaning doctors, don't really make our own schedules, meaning we are usually assigned a template that is created by the organization that you work for. So whether it is a private clinic, whether it is a academic medical center or whatnot, you don't really have a say in how long you want your visits to be. It is a template of 15-minute appointment slots. And if there is an open slot, the scheduler, who I have no control over, can put anybody that calls in into one of those slots. So sometimes you might end up with a new eczema patient, maybe very mild eczema for 15 minutes, followed by another patient who has super severe eczema for 15 minutes. And there is no way for that scheduler to know who needs a longer appointment and who doesn't because he or she is not a dermatologist and he or she is not a medical specialist. They are an administrative person that is being told to put people into those slots if they see something is open. So therefore, when I show up in the office, I am not seeing two patients that day. I am seeing 35 patients that day, right? Because they want to make sure that the practice is productive. So I think there are a lot of problems in this system when you really dig into it, but there's probably no easy solution. So if you wanted a longer appointment, you may have to find an office that offers longer appointments. And I can tell you, most dermatologists probably do not offer 30-minute new appointments. Now, there are some doctors out there who run a completely independent show where you do dictate how long your visits are. Now, if you wanted a longer visit, some of these doctors may not take insurances because they might say, well, I charge X amount of money for a 30-minute visit, for example, and that may be the model that you go. But I can tell you, having worked at many academic institutions and having many friends who are in private practice and private sectors, I rarely have ever seen an appointment longer than 15 minutes for dermatology.
Great. So I have another question here around skin exams. The person says, my dermatologist has never given me a skin exam. Does that mean I should find another doctor, or am I able to request for the provider I do have to give me a skin exam?
I think you can certainly request that. I would probably do that first. Sometimes skin exams are not done if you come in and you say, I have eczema on my eyelids. It'll be weird for me to say, do you mind changing into this gown so I can see everywhere else, right? Like that's probably not going to come off very professional. But I do think if you are someone who maybe has full body eczema and he or she has never asked to take a look at other locations that might be under clothing that have eczema, I think he or she should. I think you should say something along the lines like, hey, do you mind taking a look at my eczema on my belly or on my back or on my thighs or somewhere like that? But if you go in and you say, I only have eczema on my hands, and I ask you, do you have eczema anywhere else? And you say no, I'm probably not going to say, can you change into this gown so I can take a look everywhere else? So I think it depends on how you frame it and what he or she thinks is the most appropriate medically for that visit. But if you request it, he or she should absolutely do it. And I have never turned down a patient that says, I would like a full body exam. Great. I am more than happy to take a look at you.
Great. Couple more questions here. Our next community member says, I've had atopic dermatitis since I was a baby, and for the past 10 years, it's flared on and off. Should I see my dermatologist regularly about my eczema or only when it's flaring? If I do see my derm regularly, how frequent should those visits generally be?
Yeah, I think that's a great question. I think if you are somebody who has flares, but you're really able to deal with them. So, for example, you say, I have this cream that I put on my skin every time I have a flare. I put it on 2 days later, my flare is gone. I'm back to my happy place. You kind of already know how to manage your eczema, right? You probably do not need to see that person regularly because what am I able to tell you that is really going to be different than what you are currently doing? But if you say, my eczema is poorly controlled, I have flares that there's nothing I can do about, I have to suffer through it for 2 to 3 weeks before it gets better, or I find myself putting on this topical steroid every single day for months on end to control my skin, and once I stop, things get worse. That's the scenario where you really should be going back because then your conversation might not be it might not be, can you give me another cream or, can you give me a refill? Your conversation might be, what medication can control my eczema better? And if you have the mindset of saying, I want to go on a systemic medication to make sure that my flares are fewer, to make sure my skin is better controlled, to make sure my eczema is better, I think that is a completely appropriate reason to go back and see your dermatologist for this. So it really depends on how well you are doing controlling these flares. We know that even in the best of scenarios, people with eczema will flare from time to time. You get sick, you get stressed, something big is going on, right? All those reasons people can flare, but if your flare is uncontrolled and you don't have the tools to do it, that's the reason to see your dermatologist. I can't really dictate how often you need to because I think it really depends on your personal scenario, but I do think that's a reason to see them or a reason not to see them.
Now, this is a question actually of my own, but just sort of based on conversations I've been having with patients. I know that, right, like generative AI tools like ChatGPT are becoming a lot more popular in this space. So I'm curious if you see a role there from the patient side. Do you think it's helpful for patients to maybe use these tools prior to coming to appointments? Or is it better to just kind of collect information about, their flares, photos, etc., and more just present that to the provider as the expert? I'm just curious, like, what you see the role of these tools, not from the provider side, but more from the patient side.
I think generative AI and ChatGPT and things like that can provide really useful information. Now, is the information always correct? And I think that's what I worry a little bit about because they are only as good as the sources that they are pulling from. I've certainly asked questions and it's provided me inaccurate answers, not from the medical side, but just from kind of that day-to-day life side, right? Like whether, a restaurant is still open, whether something, what the hours of this place are, things like that. And it certainly has provided me wrong information. So I would hate for patients to use that seeking medical answers in lieu of going to see a provider and getting the wrong answer and really heading down the wrong path. That being said, I do think, if you were to ask it a very straightforward question, for example, like, does this medication have side effects or anything? I think that is going to be pulling from probably the FDA package insert or something, and you might get a pretty straightforward answer for that. But in terms of preparing for the appointment, I would still do it the old-fashioned way, where you are writing down, these are the treatments I used, these are the photos that I have for my flares, this is my history. I don't think ChatGPT is going to be able to tell you any of that, certainly not more accurately than you are able to say it yourself.
So that question is, we don't want to give you too much information during our visit, but you mentioned we should give you a full picture of what's going on with us. How do we know what's relevant to our eczema visit? And generally speaking, what we should leave out or what would be less relevant or too much information?
Gosh, that's really hard. Because I think there are people have different priorities, right? I mean, to me, for example, things I think that would be really important for me is things such as number one, on a scale from 1 to 10, how bad is your eczema? Just knowing how bad your eczema is in your perspective is one of the most important things that I need to take into consideration because that might depend on how hard or how aggressive I hit that eczema. But that being said, there may be parts of your history that you deemed to be very important, but somebody else might not. So, how your eczema affects your relationship with others, I think it's very important. And I think it might be very important to you, but maybe another patient might not bring that up because it's not as important to them. So, I guess what I'm trying to say is bring up everything that is very important to you because don't guess what is important and what is not important because I think everything that is important to you is important to me when it comes to understanding how your eczema affects you. So if you say my eczema on my scalp is the most bothersome, great. Your scalp eczema is the most bothersome. There is no reason to leave that out. Just because you have bad eczema on your hands, I am not going to say your scalp is less important than your hands. I think whatever you feel like is the most important, you need to bring up during your visit and do not leave details out. I am somebody that likes to get as much information and as full of a picture as I possibly can get so I can best understand your eczema and you as a person. But that's just me. Maybe other people are different, so I can't speak for other dermatologists. I can't speak for other patients, but at least from my perspective, I always think more is more, and I think if you're able to tell a streamlined story, give a streamlined history, show me the photos, I really don't think that takes more than 15 minutes. So and I think that's completely appropriate in the context of a visit.
Great. Well, I think that was our last question. So I think we are pretty much wrapping up here. You can register for an upcoming webinar or watch the recording of a previous webinar at nationaleczema.org/webinar-Wednesdays. And on behalf of the National Eczema Association, I thank you all for joining us.